What is a false positive TB test result? Imagine getting a test that says you have tuberculosis when you actually don't. That's what a false positive TB test result is. It happens when the test shows you have TB bacteria or an immune response to TB, but you are not truly infected. This can cause confusion and lead to unnecessary worry or treatment. There are two main types of TB tests where false positives can occur. The first is the tuberculin skin test, also called the Mantoux test, and the second is the blood test known as an interferon gamma releases assay. Both tests look for signs that your immune system has reacted to TB bacteria. A false positive in these tests means your immune system responded as if you had been exposed, even if you haven't. One common reason for a false positive in skin or blood tests is prior vaccination with the Bacillus calmette-guerin vaccine. This vaccine can cause your immune system to react similarly to TB bacteria, leading to a positive test even if you are not infected. Exposure to other non-tuberculosis mycobacteria, which are bacteria related to TB but not harmful, can also trigger a false positive. In laboratory tests that detect TB bacteria directly, like cultures or molecular tests, false positives can happen due to contamination or errors during sample processing. For example, if bacteria from another sample accidentally mix in, or if there's a mistake in labeling, the test might wrongly show TB bacteria are present. These errors are rare but important to recognize. False positives are problematic because they can lead to unnecessary treatment with antibiotics, which can have side effects. They might also cause a person to be isolated or undergo contact investigations, which can be stressful and disruptive. On a public health level, false positives can make it seem like TB is more common than it really is. To reduce false positives, laboratories follow strict quality control procedures. Proper handling of samples, careful test administration, and accurate interpretation are key. Healthcare providers also consider the person's symptoms, risk factors, and other test results before making a diagnosis. If a test result seems inconsistent with clinical signs, doctors may recommend retesting or additional tests to confirm the diagnosis. In summary, a false positive TB test result is when the test wrongly indicates TB infection in someone who does not have it. Understanding this helps ensure that people are not misdiagnosed and receive the appropriate care. Always remember, if you have concerns about TB testing, it's best to discuss them with a healthcare professional who can interpret results in the context of your overall health.